You're welcome back to our presentation, the second presentation for today. So, without wasting time, we move over to the next topic, which is side effects and therapeutic uses of antidepressant drugs. So, without wasting time, I want to invite the second presenter for today. You're welcome. You're welcome. You're welcome. All right.
Good day, everyone. My name is Yakin Ibrahim Alaskani. I will be presenting on side effects and therapeutic use of antidepressant drugs. Okay, antidepressant drugs are classes of drugs that used to treat depressions and other mental health issues. Okay, antidepressant drugs were first introduced in 1950s with the development of tricyclic antidepressant and monoamino acid inhibitors. Over time, newer generation of antidepressants have been developed to improve efficacy and reduce adverse effects. Today, SSRI and SNRI are among the most commonly prescribed classes due to their favorable safety profiles. Mechanism of action of antidepressants generally work by increasing the concentration of specific neurotransmitters in the synaptic clefts of neurons. The three main neurotransmitters involved are serotonin, norepinephrine, and dopamine. These chemicals are believed to play crucial roles in regulating moods, emotion, and cognitive functions. For examples, SSRIs inhibit the reuptake of serotonin into the presynaptic neurons, thereby increasing its availability in the synaptic clefts. Similarly to SNRIs, block the reuptake of both serotonin and norepinephrine, work by inhibiting the enzymes monoamine oxidase, which break down these neurotransmitters. Okay, type of antidepressant. Antidepressants are grouped into several classes based on their chemical structures and mechanism of actions. Each class varies in its efficacy, side effect profile, and clinical applications. The five major categories include SSRIs, SNRIs, TCAS, MAOIs, and atypical antidepressants. Number one, selective serotonin reuptake inhibitors, which is SSRIs, are the most commonly prescribed antidepressants due to their relatively mild side effect profile and high efficacy. They work by selectively inhibiting the uptake of serotonin in the brain. Those increase its availability in the synaptic clefts. Mechanism of actions of selective serotonin reuptake inhibitors, which is responsible for the reabsorption of serotonin into the presynaptic neurons by preventing reuptake. Serotonin remain longer in the synaptic space, enhancing its mood regulating effect. Examples are fluoxetines, sertralins, fluoxetines. Clinical uses of selective serotonin reuptake inhibitors are effective in treating major depressive disorders, generalized anxiety disorders, panic disorders, obsessive compulsive disorders, and post-traumatic stress disorders, which is PTSD. Common side effects: we have nausea, insomnia, sexual dysfunction, and headaches, and other effects. SSRIs are generally safer in overdose compared to other antidepressant drugs. Second type of antidepressant, serotonin norepinephrine reuptake inhibitors, are second generation antidepressant drugs that inhibit in the reuptake of both serotonin and norepinephrine. They use when selective serotonin reuptake inhibitors are ineffective or when patients exhibit symptoms of both depression and chronic pains. Common side effect, sweating, dry mouth, increased blood pressure, dizziness, and gastrointestinal upset. Third, third type of antidepressant drugs. We have tricyclic antidepressant are among the oldest classes of antidepressant. Why effective? They are associated with the more side effects and more refers for treatment resistance cases. Mechanism of action of tetracyclic antidepressant drugs. Inhibit the reuptake of norepinephrine and serotonin by blocking NET and SAT. They also affect histaminergics, cholinergics, and alpha-adrenergic receptors, which contribute to their broader side effect profile. Example: amitriptyline, chlomipramine, used for depression, neuropathic pains, and nocturnal ergosis, bedwetting in children. Common side effect: dry mouth, blood fissions, urinary retention, constipation, weight gain, sedation due to cardiac toxicity. They are dangerous in overdose. Atypical antidepressant. This is a heterogeneous group of antidepressants that do not fit into the other categories. They work on different neurotransmitter systems and are often used when patients cannot tolerate selective serotonin reuptake inhibitors and others. Mechanism of action varies by drugs. For example, bupropion inhibits reuptake of dopamine and norepinephrine. Examples: we have trazodones and others. Common side effects: bupropion side effects are insomnia, dry mouth, seizure risk at high doses. Therapeutic use of antidepressants. Antidepressants have a wide range of clinical application extending beyond the treatment of depression. Many of these drugs are used off-label for anxiety disorders, chronic pains condition, and other psychiatric and medical illness. Their efficacy in modulating neurotransmitter pathways make them versatile tools in both psychiatric and general medication patients. Major depressive disorders. The primary indication for antidepressant is major depressive disorders, MDD, a condition marked by persistent sadness, loss of interest in activity, sleep disturbance, appetite changes, and impaired concentrations. Treatment: achieve remission, complete resolution of symptoms, prevent relapse and recurrence, improve overall quality of life and functioning. Anxiety disorders, generalized anxiety disorders, panic disorder, and social anxiety disorders. Antidepressants, particularly SSRI and SNRI, are first-line pharmacological treatments for several anxiety disorders. They are preferred over benzodiazepines due to their non-addictive profile and long-term safety. We have post-traumatic stress disorder, PTSD, result from exposure to treatment event, and it is marked by flashback or nightmare and hyperarousal and avoidance behavior. Antidepressant use are sertraline, paroxetine, and others approved for PSD treatment. Consideration may be combined with psychotherapy for enhanced outcome, often used long term in chronic PTSD cases. Side effect of antidepressant drugs, while effective in managing psychiatric and certain non-psychiatric conditions, are associated with a wide range of side effects. These effects very depend on the drug classes, dosage, patient age, genetic factors, and duration of the treatment. Understanding this adverse effect is critical to balancing the benefits of treatment against potential harm. Common side effects: most antidepressants cause predictable dose-dependent side effects. These are generally mild and transient, but may lead to non-compliance if not properly managed. SSRIs and SNRIs: gastrointestinal symptoms: nausea, diarrhea, abdominal discomfort are most common during the first week of treatment. Sexual dysfunction: decreased libido, delay delay organisms, and anorgasmia are frequently reported, particularly with SSRIs like fluoxetine and paroxetines. TCA: anticholinergic effect, dry mouth, constipation, urinary retention, and blood fission, sedation, and weight gain due to anticholinergic actions. Serious adverse effects: most antidepressants are safe when used appropriately. They may cause serious adverse effects, some of which are potential life-threatening. Suicidality: meta-analysis show a modest but statistically significant increase in suicidality among youth taking SSRIs compared to placebo. Drug interaction management: discontinued serotoninergic agents, supportive care, serotonin antagonist. Long-term side effects and withdrawal: antidepressant discontinuation syndromes. 20 to 50% of patients who abruptly stop or rapidly taper antidepressants, especially SSRI, with a short half-life, like paroxetine. Symptoms: dizziness, flu-like symptoms, insomnia, irritability, brain zaps, usually self-limiting but distressing. Emotional blunting: some patients report a flattening of emotional response, which may affect both positive and negative feelings. Antidepressants are not considered addictive, but tolerance may be developed in some patients, requiring dose adjustment in rare cases. Long-term use may result in diminished effectiveness, tachyphylaxis, or Prozac pop-out. In summary, while antidepressants are generally safe and effective, clinicians must balance therapeutic benefit with the risk of adverse effects. Understanding the specific side effect profile of each class aids in personalized treatment selection and enhance medical adherence. Monitoring patient education and early identification of serious adverse events are essential components of effective antidepressant management. The prescription of antidepressants must account for patient-specific factors such as age, pregnancy status, comorbid conditions, and concurrent medications. This consideration affects drug selection, dosage, monitoring, and patient outcomes. Antidepressant uses in children and adolescents. Antidepressant use in individuals under 25 is associated with small but significant risk of increased suicidal ideation and behavior. This may lead to FDA black box warning for all antidepressants in pediatric patients, FDA 2004. Monitoring, weekly check. Monitoring uses in antidepressant in children and adolescents. Weekly checks during the first month. Be weekly for the next 2 months. Observe for agitation, irritability, worsening moods. Uses in elderly. Consideration: elderly patients are more vulnerable to side effects due to altered pharmacokinetics, comorbidities, and polypharmacy. Risk factors are hyponatremia, especially with SSRI, fall and fractures, cognitive impairment. Uses of antidepressants during pregnancy and breastfeeding. Pregnancy consideration. Depression during pregnancy poses risks such as poor self-care, substance use, and suicide. However, some antidepressants can affect further development. Recommendation: use only if benefits outweighing risk. Sertraline and fluoxetine are commonly chosen for their favorable safety data. Breastfeeding: most SSRI are excreted in breast milk in small amounts. Sertraline and paroxetine are preferred due to low infant exposures. In summary, prescribing antidepressants require more than choosing an effective drug. It demands individualized care tailored to the patient's age, health status, reproductive consideration, and current medication, safe and effective use of antidepressants. On-thought evaluation, dose adjustment, regular monitoring, and proactive management of potential complications. In conclusion, antidepressant medication have transferred the treatment landscape for a wide spectrum of psychiatric and medication conditions. Their primary role in managing major depressive disorder has been firmly established through decades of clinical experience and robust scientific research beyond depression. These agents are essential in treating anxiety disorders, obsessive-compulsive disorder (PTSD), chronic pain syndromes, and certain eating disorders. However, the benefit of antidepressants must always be weighed against their potential risk. Common side effects like nausea and sexual dysfunction may impair adherence, while serious side effects such as suicidal ideation or serotonin syndrome require vigilance. Special population, including children, the elderly, pregnant women, and polypharmacy patients. Carefully drug selection, dose adjustment, and choose and close monitoring. Successful antidepressant therapy depends on individualized treatment plans, comprehensive assessment, and ongoing patient education. Non-pharmacological intervention, especially psychotherapy, should be integrated for optimal outcome as mental health care involves ongoing research into safer and more effective antidepressants will continue to shape clinical practice. Ultimately, the junction use of antidepressants can lead to significant improvement in quality of life, functioning, and overall well-being for individuals suffering from mood and anxiety disorder. Thank you. Sorry. Okay. Sorry.